Welcome back. I want to talk about my experience actually working as an EMT. So we talked before, I kind of gave you guys a rundown about what school looks like, but what does it look like once you've actually got a job and you start actually doing the work? Well, I got my first EMT job about 4 months after I graduated from my program. It was at a private transport company in the city where I live. And so I got hired on there and started working there and ended up, it was me and another EMT. Now, private transport, as most people who work in this industry know, um, generally what you're doing a lot of, there's a couple different types of runs that you do a lot of. You do a lot of hospital to hospital transfers. You'll take people from the hospital back home. You'll take people to doctor's appointments, dialysis, any number of other medical procedures done. Um, any number of medical procedures that people need done, and they can't go in a private vehicle of some sort. That's where we come in. So that's what I started doing, and I worked at that. The first truck I was on is me and another EMT. So I did a lot of what I just described, and we did that for about 8 months or so. After that, the partner that I had been working with actually left our company, so I was now partnerless, and I actually got paired up with a medic. This was probably one of the best things that could have happened to me because he kind of broke down what I had been doing. It was like, okay, let's see if we can get you actually working better as an EMT in the context of being an EMT on an ALS truck. Because if it's just EMT and EMT and you work for a private transport service, unfortunately, what can happen is that you tend to kind of get into a rut of complacency. Might be too strong of a word, but unfortunately I do think it is accurate in this case, because there are some days you walk into work and you can literally know exactly which runs you're going to get at what time, and there's no your days become very monotonous, which, as anyone will tell you, does and definitely can breed complacency. So when I transitioned over to working with a medic, we still had to do all the stuff that I just described, but we also tended to have transports that did involve my paramedic partner having to use his ALS skills, which was a great eye-opener for me because, again, that's where I started to learn how to act as an EMT in the context of working with a paramedic. So you're working on ALS assisting. And then I was on the truck with him for right about a full year. And then after that is when I went to paramedic school. So what is it like working as an EMT when you get on the truck? Well, a lot's going to depend on where you're working. It's going to depend on your partner. It's going to depend on the types of runs that your company or department tends to get. Those are going to be factors that will change how they will inform your experience. But the biggest thing, and I would say if there's one lesson that I could give you guys that I would want you to take away from this, when you get on a truck as an EMT, that is where you need to start building your foundation of basic skills. Taking a good set of vital signs, and that does include learning how to do a manual blood pressure. The 911 service that I worked for as a medic, they didn't have auto cuffs on their trucks anywhere. You had to do manual blood pressures. And spoiler alert, you can do a manual blood pressure a lot faster than those auto cuffs work. I don't care how fast they are. Maybe now they're starting to get to the point where they're almost quicker, but but you can manipulate yours a whole lot faster. Anywho, so you're going to get really, really good at vital signs. You're going to get, hopefully, really good, because you should be doing this on every patient, listening to lung sounds. I'll have a story coming up in a few videos where I tell you how listening to lung sounds on a patient that I thought was pretty innocuous saved my butt on it. But we'll get to that. So vital signs, lung sounds. You'll learn how to do something as simple as feeling for pulses, because that can actually tell you quite a bit about a patient. In the adult population, it's not as big of a deal in terms of comparing pulse strengths and pressures outside of a traumatic situation. But on your kids, especially on your really little babies, that can make a big deal. A difference in pulses can mean that there actually is something pretty significant going on. You're going to learn to check things like capillary refill. You're going to start doing that automatically with your patients. And again, you'd be amazed how much that can tell you about the patient's perfusion status. Well, really, mostly perfusion status. But if you see a problem there, that can kind of trigger an alarm bell. It's like, hey, I think there's some other things that we should look at. You'll learn to start looking at skin signs. Because one of my paramedic preceptors told me, skin signs don't lie. If someone is losing blood, if they're having trouble breathing, if they are septic, or if they're experiencing like an MI, a heart attack, they don't look right. And when you start looking at someone and being like, and you will get to this point if you do this long enough, you can look at somebody from across the room as just like, that's a problem. Something's going on there. That's the point that you're going to get to. And being an EMT is the perfect time to learn that. Why? Because you're not burdened with all the other crap that you have to learn once you get to the ALS level. You can just focus on those couple of things: vital signs, lung sounds, pulses, skin signs, capillary refill. And if you can get really good at doing a real fast assessment just on those things, it can tell you a lot about a patient. So that's just an example of the things that you can learn right off the bat. And that's what I spent the first almost 2 years of my EMS career doing, was working private service as an EMT. And again, the amount of things that you can learn just from doing that are incredible. All right. Now, the second kind of major thing that I want to hit on that you can learn as an EMT, or really that you will start to learn as an EMT, and if you progress in your pre-hospital career, you will continue to evolve in your learning of this, is operating under protocols. This is something that is almost completely unique to EMS. In some community medicine scenarios, smaller hospitals, non-academic centers, there are sometimes where nurses will have kind of a playbook that they can go to first, and they can implement orders as needed. And also, same thing with paramedics and EMTs who work in that facility. It's just going to depend on what your facility allows you to do. But in the pre-hospital world, your protocol book, which is a set of guidelines given out by your medical director at the start of each year, that is the parameters that you're allowed to operate on. So everything contained in that book, that is what you can go by. That is your right and left flank. And I have had the chance to work under 3 fantastic medical directors. All 3 of them basically told us the same thing, whether I was an EMT or a medic. They said, if you stay within the right and left boundaries of the protocols that we lay out for you, and if you make sound clinical decisions that are in the interest of the patient, we will back you. Now, you stray outside those boundaries and you do something that screw up. And I had one of my first medical directors, he's like, you stay inside the box, make good decisions on behalf of the patient, I'll back you. Stray outside that box and screw up, I'll hammer you without mercy. So it's pretty black and white. That book is your Bible. And the first thing that you, and as an EMT, when you first start operating in those things, you can start reading it. And the first thing you need to do is you need to understand every BLS protocol in there. You need to just know them cold. Front, backwards, sideways. You should almost be able to quote it back. In fact, the medic that I worked with at my first job, he would quiz me on protocols from the book, and he would make me go almost verbatim through them. Like I had to be able to do it. That's the level that you want to get to. And once you get comfortable with the BLS side, even as an EMT, read the ALS side. Because if you get paired up with a medic and you get something really screwed up that happens, and it's like, oh, this is a stroke, so we got to do this, this, and this. You're already working towards it because so that you can help out and be able to do that, and so that you can provide the best patient care possible. So overall, let me just leave you with this, talking about being an EMT. Your job is to master the basics. That is really what you are there for. And you want to get to the point where all those things that I talked about earlier, vitals, lung sounds, all that stuff, you need to be able to do that without even thinking. And you need to know that you have taken accurate measurements. Because if you get into a situation that's really bad, and if you're with an ALS provider who needs things done fast, and if you need to give accurate information, if you're trying to call report to the hospital, you got to make sure that the information that you're going to give is accurate. Because having worked both in the pre-hospital and on the in-house side, there is nothing worse than getting a report from an EMS crew, and it turns out that what they told us wasn't accurate. First off, it's annoying in the in-house side because then we're playing catch-up. But as a former pre-hospital provider myself, it's frustrating because it's like, guys, you're making us look bad. You don't want to be that provider. And then last thing I'll leave you with, the other important thing as an EMT, know your protocols front, backwards, and sideways. Be able to recite the book back. Because again, it's just going to get you ready so that when you land in a crappy situation, you can immediately remember back, oh, that's this protocol. Here are the 5 steps. Let's go. So that's the video for now. Let me know if you have any questions. Throw them down there. I'm more than happy to answer them. Thanks for hanging around. See you on the next one.